to Cannabis Health Radio, where we share powerful, real-life stories from people around the world who are using cannabis as medicine. The goal of this podcast is to raise awareness of the healing potential of cannabis and is not intended as medical advice. And now, here's your host, Ian Jessop.
Welcome to the Cannabis Health Radio podcast. I'm Ian Jessop. Addiction is a battle that many face in silence, but today's guest is breaking that silence with a story of resilience, hope, and transformation. Joe Garcia of Phoenix spent most of his life struggling with depression and substance abuse, starting at just 13 years of age when he became addicted to cocaine. From there, his journey spiraled into crack and meth addiction, and for years, he lived a life that seemed impossible to escape. But today, Joe is here to share his incredible journey from rock bottom to rebuilding his life and how cannabis and CBD played a crucial role in that transformation. Joe, good of you to do this. Greatly appreciated. When you walk down the street and you see a drug addict, what goes through your mind?
A couple things go through my mind, but I think where I land most is compassion. The understanding of just the desperation, just to get that next hit, and everything that goes along with that. The degradation of your self and your worth and your values just all go out the toilet. And so I have deep compassion, and but then there's also the side of it is there's some concern and safety issues too. I was around a lot of bad people and a lot of bad things happened, and unfortunately in this day and age it's a little bit of both.
I was really surprised that you were into cocaine at the age of 13, because I look back at myself at 13 and God, I was just smoking, but you were into cocaine. How did that come about?
So that's an interesting story. So I have an older sister, and at the time she was dating a guy that my parents did not approve of, and for good reasons. But so my parents would make me go out with them when they went out on a date, third wheel kind of thing, thinking that was going to stop them from doing whatever they were doing. And it didn't work, because it was during the 80s, so pool halls and video game arcades, that's where we'd go. And they would sneak off into the bathroom, and I thought it was to make out and stuff. But then after a little while, a few times of that, they actually showed me what they were doing, and they brought out this glass tray and it had a mound of white powder on it, and they just started snorting cocaine right in front of me. And I'm like, oh, well, I want to try some of that too. And because of the depression and the things that had happened to me in the past, it was like, oh yeah, this is what I've been waiting for, looking for all my life. This is the cure-all for me. And that was it. It was off and running. And it didn't take too long for me to end up, at a bottom. And I think I was before even turning 18, I went into my first rehab.
How is your sister still alive today?
Yeah, she's still alive, living out in California.
Yeah. So when you started taking cocaine, how did you obtain it? How did you get the money to buy it at such a young age?
The great thing was that they always had it. Oh. They were working people, and so I ended up being the third wheel. But it was a great thing for me in my addiction that I was starting to it was starting to blossom. And I learned to drive a car at 13 years old, stick shift. Mm-hmm. I would drive them when they were too impaired to drive. He lived up in Costa Mesa, and we were in El Toro at the time, now called Lake Forest. And so I learned how to drive at 13 years old, stick shift. So it was really reinforcing. But when that stopped and went away or whatever, I got involved with obtaining it and selling it to my friends as well. And so I always had some. And I had jobs, mowing lawns and different things like that, but cocaine was expensive, and it was primarily the contact with my sister and her boyfriend.
When you talked about your use of cocaine, and you said it was something that you kind of looked forward to all your life because of the depression, what was the depression about? Do you know?
I've never gotten to the bottom of what was the root cause of all that. And you got to know too that I didn't know I was depressed. I didn't have anything to compare it to. I just thought that's how everybody felt and lived. And again, this is the late 70s, early 80s. And I was acting out a lot in elementary school. And so when I did find weed, we started smoking pretty early age. I think it was like 10 is when I started smoking weed. It was just I was self-medicating, and I think it was self-medicating before they even had a term for it, to be honest.
Yeah.
And I just wanted to feel something different, but I don't know. I have my suspicions, and later on things would happen again, and it's all I'll say sexual abuse, SA type stuff. At a very early age, I have memories which I thought were dreams, maybe, or just I don't know what you would call them, but there's flashes of some things in there from people in the neighborhood and such. So I would have to say something happened, or I'm just chemically imbalanced at some point, and it just came out that way. But I really don't have any answers for the early onset of the depression. Later on, 13, 14 years old, then it became something additional happened, and that made it very clear. But early on, I just don't know.
When you say something additional happened, you want to talk about it?
Yeah, I mean, that certainly fueled my addiction, my drug and alcohol use. I had an older cousin. He was same age. I have a brother also. My brother's 5 years older than me. My sister is 6 years older than me. And this cousin was about my brother's age. And my grandfather had passed away, and it was the first real close connection of somebody that I knew that had passed. And so there were some feelings there. And didn't really know how to process that. So drugs and alcohol were in my arena. And so I was using that quite a bit. Well, this one cousin kind of took me under their wing, I thought, and would listen to me, male cousin. And all the attention that I wanted to get from like my brother or other family members, really, to talk to me about what had happened with my grandpa. I had some feelings. This person would listen to me. And, we'd go out and do stuff. He had a girlfriend, and his girlfriend had a little sister my age, and we went to Disneyland. It was that. So I spent the night at his house, and the night before we went to Disneyland, I woke up early in the morning, and he was doing stuff, and that really messed me up. Even to this day, I still have those struggles, because when you're that young and that's your first experience, it gets imprinted on you and embedded, and that's just the way I believe God made us. So to unite in that first, that's why we should get married and all these other things. But I would learn that stuff later. But that's what happened, and the drugs and alcohol fueled that. We'll call it a relationship that lasted a lot longer than it should have. But I had no idea. I figured, this must be who I am, and I struggled with that most of my life.
So when you were on cocaine, how long were you on cocaine before you transitioned to harder drugs? Well,
cocaine's not necessarily a lighter one or an entry level. That's kind of right there towards the top. But as long as cocaine was around, that's what I did. And it progressed from snorting it, and I started having some nasal issues and light bleeding and just irritated all the time. Lost incredible amount of weight. I was never a chunky kid anyway. And that was another reason why later on weight led me back to it. But it was not working anymore, and in the crowds that I was working or living around, they started doing freebase, and so that was before crack. So back in the day, they would use ether as the medium to ignite and stuff. And that's highly flammable. We know what happened with Richard Pryor. and it had already happened by then, so I was aware. But man, smoking it was next level for me. That took the snorting it to, I was literally in heaven constantly. But I didn't know how to do that on my own. I always had to rely on other people. And then later on, those same people introduced shooting it up. And that was the definitive moment in my life. I had gotten a needle, gotten a spoon, got it, and I had seen him do it enough. I'd never done it. I had seen him do it enough that I figured, okay, I can do this myself. And in my bedroom, probably family downstairs or whatever, I was ready to go and ready to inject it. I was drunk, I remember that. And it was like a literal light went off. Moment of clarity, they call it. And it said, you do this, you're going to die. Mm-hmm. And I called my girlfriend at the time and said, hey, I need some help. And by this time I was like 17, I said. I was already graduated high school. And I was working for a guy that was a major importer from Colombia of cocaine. So I kind of progressed in that. But I told her, look, tomorrow when I'm at work, this is before cell phones and stuff, when I'm at work, you call my mom and you tell her that I need help. And no matter what I say tomorrow, you make that phone call. Well, I'm at work the next day. I completely forgot about everything. And I get a phone call at work or whatever it was. And I think it was my girlfriend called and said, hey, you need to go home. Your mom's waiting for you. And I'm like, what? No, I totally forgot to call her the next morning when, moment of reason and it came. I didn't call it off. And oh no, this is the worst thing ever. And so I go home, and it's funny now, but they had already talked to the insurance company. They'd already talked to this place called Starting Point in Costa Mesa, of all places, which was very, like, a mile away from where my sister's boyfriend lived and where we would go. Mm-hmm. And so when I came in the door, he was standing by the stairs that go up to my room, and he was standing there like a soldier, and because they'd already told him, whatever you do not let him out of your sight. Once he knows he's going in, and they were right, because that's where my last hurrah was upstairs. All my stuff was upstairs, and I'm going to go into rehab sober. Are you kidding me? And so that's what happened. As I went into a starting point, it was like 28-day program back then. Mm-hmm. And I got introduced. I'd already had a little experience with AA because of a friend of mine had gotten a DUI, so I'd go to AA meetings with them. So I already kind of understood, but it was the first time since probably 10 that I didn't have a substance in me whatsoever, and it felt good. It felt really good to be that clean, and it didn't last. There was quite a few struggles and missteps along the way, but that's also part of recovery, I believe.
Yeah.
So that's how I came to my moment of clarity.
Did your mother or your parents know all this time that you were taking drugs?
I don't know what the actual honest answer is. I would say, how could they not? So by this time, my sister had already gotten in trouble. She'd already gotten pregnant out of wedlock. Not that that's neither here nor there, but that was just something that had happened. She wasn't with the same guy. My brother got kicked out of regular public high school and had to go to a continuation school. So all the signs that every single one of us had some issues was there. I was skinny. I don't remember how I treated them, but there was a couple of times coming home drunk, so they knew. They had to have known. But I don't know that they fully bought into that it was cocaine. I think that when they found out that, because in these rehabs they have the family day, right, and you share things, and I think that blew them away. And you need to know too that they never. Well, my mom's since passed. My dad's still alive. My brother's still alive. My brother's the only one that I've told in the family about this, and my sister and I have been estranged for a long, long time. For a lot of different reasons, but I think the signs were there. But again, I'm the third kid. I would find out through this process that I was a surprise in the family, not necessarily a planned, pregnancy thing. And I'm sure they're blessed now, but back then, it was a little rough. So I think they probably had their suspicions.
Yeah, you were into rehab, and then you had some lapses, which you said is pretty common. And how long did these lapses last?
Okay, so the first one, I got a rehab, then my sister got married. I was sober through all of that. And it was about 6 months because I had decided that, okay, it's time for me to actually enroll in community college and get my life together. And I did, and it was probably about 6 months into sobriety, going to AA every day, going to codependency meetings, NA meetings. I was doing all of that stuff. All the stuff they introduced to me, I was doing. But it was in college, and it was in one of my classes. I think there was a conflict with somebody. I had a girl I was dating, and one of the other guys just stole her or whatever. But I don't. Anyway, so I think that set me off a little bit, and then I was also trying to date. Like I grew up Catholic, so I knew a bunch of girls from school that were Catholic. I'm like, well, I just need a good Catholic girl. Mm-hmm. And boy, was that eye-opening, because the stuff they were actually doing was, not as worse as what I was doing, but none of that helped me. So I'm finally like, wait a minute, I'm the most boring person that I know. I used to be so much fun. I was the life of the party. People loved it, in my mind, right?
Yeah.
Ask them might be a different answer, but so in my mind, this is. I'm so young. I'm sure I could. Now that I know, I'm sure I could do better at maintaining it. It's all about not getting excessive with things, right? All these lies we tell ourselves. So it was about 6 months, and I relapsed, and I searched out for my sponsor. He was the guy that I met while I was at Starting Point. And I couldn't find him, and turns out he had relapsed down in Mexico, and nobody ever heard from him again. So I was kind of stuck in it. I was about 6 months. I relapsed, and the relapse itself lasted. I say it was probably about a year, and yeah, it was about a year. Within a year, because then I had another situation pop up, and I actually went to my parents and said, "Hey, I need to go back." So it got to where it took me 3 or 4 years before, or whatever it was, or 13, 4 years or so to get. Mm-hmm. Within 90 days, I was right back to doing the amounts, the levels, and the behaviors that I was doing. So, and mind you, cannabis was always in there, but it was never really, I used it to bring me down, mostly. Yeah. To kind of get me to the point where I wasn't just a freak,
What was your lowest point throughout your journey?
There's been a few, and they're different sequences of my life. But in that time period, it was that evening. I had gone back to the people that I was partying with before, people I knew from high school, and then, of course, those other people. And something happened. I just got set off. And I remember putting my hand through where they have a fire extinguisher, and there's some glass there.
Oh, yeah.
I punched that, and I ripped open my hand. I was bleeding everywhere. I needed to go to the emergency room, and my friends took me to the emergency room, and I was just so out of it. They're asking you questions left and right. I was in no condition. I should have said attorney or something, but they're asking me all these questions, and I guess based on the way I answered the questions, they thought I was trying to hurt myself. And so I got put into probably it was like a 42 or 48 hour, 72 hour hold at a psychiatric place in Santa Ana, California. And I mean, that was wild. I was in, I'm like, these are not my people. I mean, I just got a drug problem, but I don't have these kind of problems. And so then from there I went back to Starting Point for a second stint. And but it was that night. Just a lot of things went bad that night. I said some things. Some police were involved, and at that time, that was bad. It's kind of hard to hide this, and so it was bad. I think I brought some shame to my family a little bit, and of course to myself. And some of the things that I said, people had to be notified. It was just a huge mess. I felt just like such a huge ass and a loser, and but I found myself in the right place, which was a psychiatric hospital, learning some of those things, tools and such, and then back in rehab with the experience of no, I don't got this. This is a little something different.
Was when you went back to rehab, was that the last time you were in rehab? Or did you relapse
Yes.
again? That was the last time?
Oh, I would relapse many times throughout my life.
Okay.
By the grace of God, right now, I just celebrated 10 years clean and sober. So you do the math, like, well, there's a lot of years of there, but there's a lot of years of sobriety mostly, but bouts of relapse that were just progressively worse as the years went on. So, but yeah, I was I left that place, and again, the insurance at that time instructed my folks that he needs to go into a sober living right after he gets out of this, and that was a 90-day program. It was called Yorba House, and that was in the Orange area of California, and that is what I needed. I was surrounded by a lot of different levels of drug abuse, and also a lot of mental things, and I got to see my sexual addiction as an underlying thing that was really driving some things. Again, that struggle, am I gay? Is that what this is about? But hiding it and denying it and living that way or whatever. And so going to the opposite extremes, it really exposed a lot of things. But from there, I started going to AA, and I would stay, I think the first time around, I made a year. Then I relapsed. Then I got, I was married actually. I got married shortly after. I figured my life was over. You know, I might as well get married. But I always loved kids, always wanted to have kids. So that's what really drove me. So in 1990, I got married. So we're talking a couple of years here. I graduated high school, 87. First rehab, 88, 89. It's probably 89. And then a year later, I'm getting married. So, yeah, I stayed sober for about a year that first time. And then I got married, and it was about 5 years. Yeah, it was about 5 years at that point. I stayed sober for 5 years straight. My oldest was born, never knew me drinking, and then the depression hit again, and I went back to cocaine and discovered meth at that time too.
Wow. You know, listening to your story, it's interesting because you've been 10 years clean. So just in my calculations, you started when you were 13 and you're 10 years. So you were into your 40s by the time you got clean. Do I have that right? Early 40s.
And again, in between there's a long period. I got married, ended up having 2 kids. We ended up moving from Orange County, California, to out here to Surprise, Arizona. Mm-hmm. And I was 11 and a half years sober at that time. Married 17 years, and then the marriage fell apart, and that would eventually lead me back to drugs and alcohol first, then drugs, and but cocaine had changed. It was now crack, and so I was introduced to crack, and then it was until 10 years ago that I was pretty much using off and on. There was, again, a year at a time here, sober, whatever, but for the most part, I just I had a falling out with my kids, so I didn't have them in my life, and so there was just a lot of things fueling that depression. Like, who really cares, man? I'm just going to live my life, live my best life, not hurting anybody. You know, my dream was to end up on an island somewhere with endless supply of cocaine, and that's it. That's what I wanted. That was my big goal. You know, my why in life was that. And just sick, really sick.
Tell us how CBD helped you in your transition to sobriety.
Yeah, and it's been a real miracle find, and I'm so grateful to have met Al Morenton. But it starts when I had gotten married again, and of course that marriage didn't do well, and I found my way back to California, and I met a lady who's now my wife, and we met under really strange circumstances, but I was using and all that stuff, and I had to hide it from her. And we eventually moved in together, and she was already working out with Al. He had a fitness club that he was doing training on and everything. And so we would attend that, and I got to meet Al. And then he started having these little seminars about CBD, and he shared his struggle with his glaucoma, and it was just really impactful. And so as soon as he started making the CBD available, it was in capsule form before it started off that way. It really helped, and I started to learn about the whole cannabinoid system and how it's been depleted. I was already aware of the conspiracies of, the modern medical, AMA and all that, to take away these things that were actually helping people and providing nutrients for people and demonizing them and making people that used them as to be criminals. But so when he started talking and giving his talks on things in the 21-day reset, I started taking it, and in the back of my mind, I really was hoping I'd get high in some way, shape, or form, but it didn't. And it wouldn't be until probably some time later I would be able to reflect back and go, I haven't had cravings in a while. Because the cravings were, especially in that last stint, they were constant. There was always reasons to let my mind wander down the path of, so you've been doing okay for a while, but, and they just weren't happening anymore. And I look back and go, CBD didn't make me feel high, but what it did is it just quieted or mute those voices. I'll call them voices for no better term, that kept leading me back into relapsing. And I was able to get a.
Yeah, when you talk, I really understand what you're talking about, because CBD just kind of relaxes your body, doesn't it? It just brings a calm to you, that we're under so much stress and anxiety in our lifestyles today. The CBD brings it all down. It's almost like it says, just relax, just be quiet. And I think that's what happened to you. I mean, Al Morenton is a guy we've interviewed here. He's the guy who he goes blind if he doesn't take his own oil within 7 days. Goes blind from glaucoma, and he has a company, My Fit Life, which we are affiliated with. We're an affiliate of Al's, and I think it's just remarkable what the CBD did to you and how it really transformed your life, didn't it?
It really did. I mean, you hear the story about how I was, how I thought, how I lived my life, how I made my decisions and choices in life. And CBD, for some reason, gave me a pause in that and said, hey, let's explore over here. Mm-hmm. And my creativity's gone through the roof. I've been doing acting since then, and different things, and just the creativity side of it is really been a blessing, because I was so reserved before. Even in that crazy life, I was so reserved and conservative. But it really did. It allowed me to just, all that energy that was going out to quell and quench all that, because it was all self-willed for a lot of years, just quieting that stuff. The CBD came in, and it's not just CBD, it's the right CBD. It's grown in the ground, that's natural and organic. All of that stuff plays into it. I had to have the right CBD, and I'm so grateful that I met Al, because he is patient number one. If he doesn't have the right stuff and grown the right way, he starts to go blind. So I'm fortunate that I didn't have to go search out all the different CBDs or have an experience where, it really didn't do anything for me, like I hear a lot. So it was looking back going, wait a minute, I've been sober now a couple years. And you look back and go, wow, I think that CBD really had a part to play in that, because I didn't have the cravings and that struggle, and I wasn't reacting to life's events. Life didn't change incredibly for the good. It was pretty much how life is. There's good times and there's bad times, and it just seemed like it took the levels, the extremes, and kind of mediumed them, put them right in the middle.
Yeah.
And so, and my energy was being able to be restored, so I was able to channel that into good, positive outcomes and things. So, I take it, to this day. It's just a part of my morning routine, and, sometimes in the afternoon as well. And
how much do you take?
It's 100 milligrams a day.
Mm-hmm.
Yeah, so I used to take the capsules, so it was 250s, but Now I'm doing, like a dropper full of that.
Yeah, it's really interesting. I wish someone would do a study on this, because I think you go along the west coast of North America and you go into any city and you get to areas where people are just strung out, and they're, quite frankly, I'm going to be very blunt, they're a fucking mess. And we have it here in British Columbia. The leading cause of death in British Columbia is illicit drugs. Right. And you just see people smoking crack on the street. They're bent over. They're huddled in tents. And it's a mess. And you think, what a wasted life. What an absolute wasted life. And if someone just took some of those people aside and said, try CBD. And as you say, it's got to be the right CBD, so that's got to be worked out. Maybe these people can get their life back, because you got your life back, which is absolutely remarkable. And there doesn't seem to be any solution. Nobody's looking for a solution to this problem that I can see.
Yeah.
And
there's not a lot of money in curing anybody these days, so it is a byproduct of the system that we're in, and unless there's a overhaul, which I don't want to be negative, but I don't see that happening. It's a grassroots thing. It's a word of mouth. Hey, try this kind of thing. Maybe some of the recovery centers and detox centers, getting them to start. I mean, because when I was in rehab, they just give me a little cup of pills. I didn't know what they were, and you take them. So they could implement, CBD in that way to them and do a study that way. But I don't know, maybe RFK Jr. will do something. Who knows?
Yeah. Joe, you have a remarkable story, and I'm just wondering what would you say to folks who may have a loved one or an acquaintance they know who is really strung out on drugs, and they want to help them? What advice would you give them?
Yeah, I mean, I would encourage them, number one, to find a faith that they can go to, lean on. This person does need prayers, and those things definitely help. It's so hard because there's so many different kinds of level of addiction out there. Like me, I was not somebody that wanted to disrespect my family, so I was brutally honest with them about everything that I was doing. Mm-hmm. Probably more so than they needed to or wanted to hear. But I encourage people to be that listening ear. Judgmental, there was some of that at the beginning. My dad didn't understand. He said I needed to stop when I was drinking too much, and I stopped. Well, that didn't resonate with me. I would encourage the families to get involved in I think Al-Anon is a great system for providing some tools for family on how to separate with love, distance with love kind of thing, and not lose their mind. Celebrate Recovery is also a great one if you're a faith-based person to get into and seek that kind of support, because nobody knows how to deal with an addicted person rather than an addict. And mm-hmm. hearing from them what helped are those things. And I think there's still to this day, it's a lot better than when I started, because when I started on CBD, people thought I was breaking my sobriety because they just didn't understand. So we had Al come speak at a conference that my wife and I put on, and he talked about what CBD is, what it is not. And that was really eye-opening for a lot of people to realize that, this doesn't show up on a drug test, and like you're doing something wrong. No, there's nothing wrong with CBD. God put it into the earth for this exact reason. And so educating yourself as a family member to somebody that what they're going through, and introducing CBD, My Fit Life, Al CBD product is a great way to do that. And I don't know how long it would take for them to start seeing and feeling differently, but I have seen enough to know that those cravings will start to dissipate after a while. But there needs to be a support program involved in there some way, shape, or another, because we do things and we experience things when we're in our addiction, that require us to get help.
Mm-hmm.
You know, a
Yeah.
lot of stuff that, you know, just taking something's not going to fix it all the way. There are some root things that have happened to us that need to be talked about and dealt with in the right environment. And that does start with the love of the family, to understand that I may not know what you went through or what you did or what you had to do or what you saw. And that doesn't matter. I'm here anyway.
Yeah, a lot of it
So-
can be psychological. You know, it's not necessarily a physical addiction. It's a psychological problem that results in a physical addiction. And
Yeah, I do think that we, in my story and the people that I know, we behave ourselves into the mental problems that come. That I believe.
Mm-hmm.
Now, sometimes there are things that happen to us that are out of our control when we're little kids. We didn't cause that. We didn't ask for it. And then sometimes, because of those things or other things that we experience, the solution is to not feel it. And look, kids are growing up nowadays with commercials on there that tell them, oh, you feel this, you feel that. You don't have to. Take this, take that, take that. And so they're programmed. And I think that's by design, but they're programmed to reach for something to fix them. And these things cause problems. And the amount of chemicals that go, I mean, methamphetamine, for goodness, I didn't know it was in there half of the time. Those chemicals in our system, as Al will tell you, in our bodies are not meant to be there, are poison, and they cause problems, and physical and mental, and of course spiritual. It's a spiritual battle as well.
yeah.
So, yeah, I think it's a lot of different arms of the same problem. But things happen to us when we're little. We experience some kind of form of trauma, and your trauma might be different than mine, but it's what it is, and it's not an excuse, but it does set us on a course to reach for something, and the world is all too ready to give that to us in ample supply.
Joe, I really appreciate you sharing your story. I think it's going to resonate with a lot of people, and I think you've been very bold in sharing your story, and I want to thank you very much.
Thanks for having me. I appreciate it.
Are you looking for quality RSO or have questions about how to take it? Al Moranton with MyFitLife is our new trusted wellness partner, and Al is offering something really special for you, a completely free 30-minute consultation to discuss your specific health challenges. Al will give you honest advice about his cannabis products and wellness supplements that might help your situation. Ready to get real answers? Go to myfitlife.net/Cannabis Health to schedule your free consultation and mention Cannabis Health Radio to receive 20% off anything you decide is right for you. Thank you for listening to Cannabis Health Radio.
Thanks for tuning in. You can find more information and check out all our past episodes at cannabishealthradio.com. Don't forget to subscribe so you don't miss future episodes, and follow us on social media and our Rumble channel. This podcast is listener supported, so if you've found it helpful, please consider making a donation, big or small, right on our site. And if you know someone who could benefit from this episode, please share it with them. Leaving a quick review also helps others discover us. We really appreciate you being here. Thanks again.